Are you ready to test your critical thinking in obstetrics nursing? These 50 Nclex questions will push you to think like a real nurse on the floor, from labor priorities to postpartum emergencies. Stay till the end. The last few questions will challenge your clinical judgment and decision-making skills. Question 1. A nurse is caring for a client in active labor. The fetal heart monitor shows late decelerations. What is the priority nursing action? A. Apply oxygen via face mask. B. Increase oxytocin infusion. C. Place client in left lateral position. D. Check for umbilical cord prolapse. Answer: C. Place client in left lateral position. Rationale: late decelerations indicate uteroplacental insufficiency. Repositioning enhances fetal oxygenation. Strategy: for late decelerations, remember, turn the mother, give oxygen, stop oxytocin, call the provider. Question 2. A client at 36 weeks reports a sudden gush of fluid from the vagina. What is the initial nursing action? A. Perform vaginal exam. B. Check fetal heart rate. C. Assess amount of fluid lost. D. Notify healthcare provider. Answer: B. Check fetal heart rate. Rationale: the priority after rupture of membranes is to assess fetal well-being due to risk of cord prolapse. Strategy: after membrane rupture, always check fetal heart tones first. Question 3. A client in labor has meconium-stained amniotic fluid. What should the nurse prepare for? A. Vacuum-assisted delivery. B. Neonatal resuscitation. C. Emergency cesarean section. D. Oxytocin augmentation. Answer: B. Neonatal resuscitation. Rationale: meconium-stained fluid increases the risk of aspiration, resuscitation equipment must be ready. Strategy: meconium in fluid means prepare for possible neonatal airway management. Question 4. A postpartum client complains of heavy vaginal bleeding and a boggy uterus. What should the nurse do first? A. Call the physician. B. Massage the fundus. C. Check vital signs. D. Start oxygen. Answer: B. Massage the fundus. Rationale: uterine atony is the leading cause of postpartum hemorrhage. Fundal massage promotes contraction. Strategy: if the uterus is boggy, massage immediately before any other action. Question 5. A nurse notes variable decelerations on the fetal monitor. What is the best nursing action? A. Administer oxygen. B. Increase 4 fluids. C. Reposition the mother. D. Notify the provider. Answer: C. Reposition the mother. Rationale: variable decelerations are caused by cord compression. Changing the maternal position may relieve pressure. Strategy: variable decels equals cord compression equals change position. Question 6. A client with preeclampsia develops hyperreflexia and clonus. Which medication should the nurse prepare to administer? A. Diazepam. B. Oxytocin. C. Magnesium sulfate. D. Calcium gluconate. Answer: C. Magnesium sulfate. Rationale: magnesium sulfate is given to prevent seizures by depressing the central nervous system. Strategy: preeclampsia with clonus signals impending eclampsia, give magnesium sulfate. Question 7. A client at 32 weeks presents with painless vaginal bleeding. What condition is suspected? A. Abruptio placentae. B. Placenta previa. C. Preterm labor. D. Uterine rupture. Answer: B. Placenta previa. Rationale: bright red, painless vaginal bleeding indicates placenta previa. Strategy: never perform a vaginal exam on a client with suspected placenta previa. Question 8. Which finding requires immediate intervention in a postpartum client? A. Lochia rubra on day 3. B. Uterus firm in midline. C. Saturating 1 pad in 15 minutes. D. Temperature of 37.9 degrees Celsius. Answer: C. Saturating 1 pad in 15 minutes. Rationale: this indicates possible postpartum hemorrhage. Strategy: bleeding that soaks a pad in less than an hour is an emergency. Question 9. A newborn delivered by cesarean section shows respiratory distress. What is the most likely cause? A. Meconium aspiration. B. Retained lung fluid. C. Birth trauma. D. Infection. Answer: B. Retained lung fluid. Rationale: infants born by cesarean do not experience thoracic compression, delaying fluid clearance from the lungs. Strategy: remember, C-section wet lungs. Question 10. A laboring client has persistent late decelerations despite repositioning and oxygen administration. What should the nurse do next? A. Stop oxytocin. B. Increase 4 fluids. C. Apply internal monitor. D. Notify physician. Answer: A. Stop oxytocin. Rationale: oxytocin increases uterine contractions, worsening placental perfusion. Stopping it reduces stress on the fetus. Strategy: for late decels, stop oxytocin, give oxygen, reposition, increase fluids, then call the provider. Question 11. A nurse is caring for a client diagnosed with HELLP syndrome. Which action is the priority? A. Monitor deep tendon reflexes. B. Notify the healthcare provider immediately. C. Increase oral fluid intake. D. Prepare for cesarean birth. Answer: B. Notify the healthcare provider immediately. Rationale: HELLP, hemolysis, elevated liver enzymes, low platelets, can rapidly progress to DIC or liver rupture. Strategy: HELLP is an emergency, report it at once. Question 12. A postpartum client reports foul-smelling lochia. What does this indicate? A. Normal healing. B. Endometritis. C. Retained placental fragments. D. Dehydration. Answer: B. Endometritis. Rationale: foul odor suggests uterine infection. Strategy: always associate foul odor with infection. Question 13. The nurse notes that the client's fundus is above the umbilicus and deviated to the right. What is the likely cause? A. Uterine atony. B. Bladder distension. C. Retained placenta. D. Hemorrhage. Answer: B. Bladder distension. Rationale: a full bladder displaces the uterus upward and to the side. Strategy: encourage voiding and reassess fundus. Question 14. After rupture of membranes, the fetal heart rate increases to 170 bpm. What is the priority nursing action? A. Assess maternal temperature. B. Increase 4 fluids. C. Notify provider. D. Turn client to left side. Answer: A. Assess maternal temperature. Rationale: fetal tachycardia may indicate maternal infection. Strategy: always assess for infection after rupture of membranes. Question 15. Which nursing action is most important when a client is receiving oxytocin? A. Monitor for uterine relaxation. B. Monitor for uterine tone and fetal heart rate. C. Check cervical dilation every 2 hours. D. Record maternal pain score. Answer: B. Monitor for uterine tone and fetal heart rate. Rationale: oxytocin can cause uterine hyperstimulation and fetal distress. Strategy: stop the infusion if contractions exceed 90 seconds or occur less than 2 minutes apart. Question 16. Which newborn is at greatest risk for hypoglycemia? A. Small for gestational age. B. Preterm. C. Large for gestational age. D. Postterm. Answer: C. Large for gestational age. Rationale: LGA infants have increased insulin levels, leading to hypoglycemia. Strategy: check blood glucose within 2 hours of birth. Question 17. Which maternal condition contraindicates breastfeeding? A. Mastitis. B. HIV infection. C. Cesarean section. D. Anemia. Answer: B. HIV infection. Rationale: HIV can be transmitted through breast milk. Strategy: NCLEX rule, HIV-positive mothers should not breastfeed. Question 18. A client in labor requests an epidural. Her BP is 80/40 mmHg. What should the nurse do first? A. Position client on left side. B. Give 4 fluid bolus. C. Notify anesthesia. D. Recheck blood pressure. Answer: B. Give 4 fluid bolus. Rationale: hypotension must be corrected before epidural placement. Strategy: always stabilize BP before anesthesia. Question 19. A woman in preterm labor is prescribed terbutaline. What is the purpose of this medication? A. Induce contractions. B. Stop uterine contractions. C. Stimulate fetal lung maturity. D. Prevent infection. Answer: B. Stop uterine contractions. Rationale: terbutaline is a tocolytic that relaxes uterine muscles. Strategy: T4 terbutaline equals turn off contractions. Question 20. Which finding indicates magnesium sulfate toxicity? A. Respiratory rate 10 per minute. B. Urine output 50 milliliters per hour. C. Deep tendon reflexes 2+. D. BP 130/80 mmHg. Answer: A. Respiratory rate 10 per minute. Rationale: respiratory depression is an early sign of magnesium toxicity. Strategy: keep calcium gluconate at bedside as antidote. Question 21. A woman in labor suddenly stops contracting and reports severe pain. Fetal heart tones are absent. What is suspected? A. Placenta previa. B. Uterine rupture. C. Cord prolapse. D. Abruptio placentae. Answer: B. Uterine rupture. Rationale: sudden cessation of contractions and pain signal uterine rupture. Strategy: prepare for emergency cesarean birth. Question 22. What is expected lochia color from day 4 to day 10 postpartum? A. Lochia rubra. B. Lochia serosa. C. Lochia alba. D. Bloody clots. Answer: B. Lochia serosa. Rationale: Lochia serosa is pinkish-brown and occurs after the 3rd day. Strategy: no normal lochia progression, rubra serosa alba. Question 23. A breastfeeding mother develops mastitis. What should the nurse instruct her to do? A. Stop breastfeeding until healed. B. Apply ice packs only. C. Continue breastfeeding frequently. D. Avoid touching the affected breast. Answer: C. Continue breastfeeding frequently. Rationale: frequent feeding promotes drainage and healing. Strategy: mastitis equals feed, warm compress, antibiotics. Question 24. A newborn is placed under phototherapy for jaundice. What is the nurse's priority? A. Keep eyes covered. B. Decrease feeding frequency. C. Apply lotion to skin. D. Discontinue therapy after 4 hours. Answer: A. Keep eyes covered. Rationale: phototherapy light can damage the infant's eyes. Strategy: protect eyes, monitor temperature and hydration. Question 25. Which sign suggests neonatal hypoglycemia? A. Crying. B. Jitteriness. C. Sneezing. D. Sleepiness. Answer: B. Jitteriness. Rationale: low glucose levels cause tremors and irritability. Strategy: feed immediately when jitteriness occurs. Question 26. When is Rho, D, immune globulin, ROGM, administered? A. During first trimester. B. Within 72 hours after delivery if baby is Rh positive. C. At delivery regardless of Rh type. D. After every pregnancy. Answer: B. Within 72 hours after delivery if baby is Rh positive. Rationale: prevents maternal antibody formation. Strategy: only for Rh negative mothers with Rh positive infants. Question 27. What does the acronym GTPAL stand for? A. Gestation, type, preterm, abortion, living. B. Gravida, term, preterm, abortion, living. C. Gestational, termination, pregnancy, alive, lost. D. Gravida, term, pregnancy, abortion, live. Answer: B. Gravida, term, preterm, abortion, living. Rationale, GTPAL summarizes pregnancy history. Strategy, know how to calculate each component for NCLEX questions. Question 28. A non-stress test is reactive when the fetal heart rate A. shows 2 accelerations in 20 minutes. B. remains baseline for 20 minutes. C. decelerates after contractions. D. has variable decelerations. Answer, A. shows 2 accelerations in 20 minutes. Rationale, indicates adequate oxygenation and neural activity. Strategy, reactive equals reassuring. Question 29. What indicates placental separation during the 3rd stage of labor? A. uterine relaxation. B. gush of blood and cord lengthening. C. absence of contractions. D. passage of amniotic fluid. Answer, B. gush of blood and cord lengthening. Rationale, these are normal signs of placental detachment. Strategy, do not pull on cord, allow natural expulsion. Question 30. Which pain pattern suggests true labor? A. back pain relieved by walking. B. lower back pain radiating to abdomen. C. abdominal pain that stops with rest. D. pelvic pressure only. Answer, B. lower back pain radiating to abdomen. Rationale, true labor pain begins in back and moves forward, with regular contractions. Strategy, true labor equals progressive, regular contractions. Question 31. How does postpartum depression differ from baby blues? A. occurs immediately after birth. B. lasts more than 2 weeks with impaired function. C. improves with rest. D. has physical symptoms only. Answer, B. lasts more than 2 weeks with impaired function. Rationale, prolonged sadness and withdrawal signal depression. Strategy, screen and report persistent mood changes. Question 32. A cord prolapse is noted. What should the nurse do immediately? A. reposition the client in knee chest. B. push the cord back inside. C. apply fetal monitor. D. notify family. Answer, A. reposition the client in knee chest. Rationale, this position relieves cord pressure until delivery. Strategy, knee chest or Trendelenburg first, then call provider. Question 33. What is the purpose of the APGAR score? A. assess gestational age. B. evaluate newborn's adaptation. C. determine need for phototherapy. D. identify congenital anomalies. Answer, B. evaluate newborn's adaptation. Rationale, APGAR is done at 1 and 5 minutes to assess transition to extrauterine life. Strategy, 7 to 10 equals good, 4 to 6 equals moderate distress, 0 to 3 equals severe distress. Question 34. Which medication is contraindicated for a woman with cardiac disease? A. terbutaline. B. oxytocin. C. magnesium sulfate. D. penicillin. Answer, A. terbutaline. Rationale, it increases heart rate and cardiac workload. Strategy, avoid beta-adrenergic drugs in cardiac clients. Question 35. A woman receives rubella vaccine postpartum. What should the nurse instruct? A. avoid sunlight. B. avoid pregnancy for 1 month. C. avoid breastfeeding. D. avoid strenuous exercise. Answer, B. avoid pregnancy for 1 month. Rationale, rubella vaccine is live and teratogenic. Strategy, teach reliable contraception for 4 weeks post-vaccination. Question 36. Why is folic acid important in early pregnancy? A. prevents anemia. B. prevents neural tube defects. C. promotes placental growth. D. prevents miscarriage. Answer, B. prevents neural tube defects. Rationale, folic acid supports neural development. Strategy, supplement before conception and during early pregnancy. Question 37. Which complication is associated with gestational diabetes? A. premature rupture of membranes. B. macrosomia. C. hypotension. D. Placenta previa. Answer, B. Macrosomia. Rationale, increased glucose leads to large fetal size. Strategy, monitor fetal size and glucose control. Question 38. What is the priority after amniotomy? A. Assess fetal heart rate. B. Check fluid color. C. Check temperature. D. Record amount of fluid. Answer, A. Assess fetal heart rate. Rationale, cord prolapse is a risk after membrane rupture. Strategy, FHR assessment always comes first. Question 39. Before an amniocentesis, what should the nurse instruct the client to do? A. Empty bladder. B. Drink extra water. C. Void after the procedure. D. Take mild analgesic. Answer, A. Empty bladder. Rationale, prevents puncture of the bladder during procedure. Strategy, no difference, full bladder for early ultrasound, empty for amniocentesis. Question 40. A pregnant woman becomes pale and dizzy while lying supine. What should the nurse do? A. Turn her to left side. B. Raise head of bed. C. Offer fluids. D. Reassure her. Answer, A. Turn her to left side. Rationale, supine hypotension occurs from vena cava compression. Strategy, always position side lying after mid-pregnancy. Question 41. A postpartum woman continues bleeding despite a firm uterus. What is the likely cause? A. Laceration. B. Uterine atony. C. Retained fragments. D. Dick. Answer, A. Laceration. Rationale, a firm uterus with ongoing bleeding suggests vaginal or cervical tear. Strategy, inspect perineum and notify provider. Question 42. What does LOA fetal position mean? A. Head up, occiput left anterior. B. Head down, occiput left anterior. C. Breech, sacrum left anterior. D. Transverse lie. Answer, B. Head down, occiput left anterior. Rationale, LOA is the most favorable position for birth. Strategy, no abbreviations, O equals head, S equals sacrum. Question 43. What diet is best for a client with preeclampsia? A. High fat, low protein. B. High protein, moderate sodium. C. Low protein, high sodium. D. High carbohydrate, low sodium. Answer, B. High protein, moderate sodium. Rationale, protein supports plasma volume, sodium should not be restricted excessively. Strategy, avoid salt restriction unless ordered. Question 44. What is the safe goal when titrating oxytocin during induction? A. Contractions every 1 minute. B. Contractions every 2 to 3 minutes, lasting less than 90 seconds. C. Contractions lasting 2 minutes. D. Continuous contractions. Answer, B. Contractions every 2 to 3 minutes, lasting less than 90 seconds. Rationale, prevents uterine hyperstimulation and fetal distress. Strategy, monitor FHR and contraction pattern closely. Question 45. What color is normal amniotic fluid? A. Yellow. B. Green. C. Clear. D. Brown. Answer, C. Clear. Rationale, green indicates meconium, suggesting fetal distress. Strategy, note color and odor at rupture. Question 46. What is the first nursing action for uterine inversion? A. Stop oxytocin infusion. B. Massage uterus. C. Give fundal pressure. D. Encourage ambulation. Answer, A. Stop oxytocin infusion. Rationale, oxytocin causes further inversion, stop it immediately. Strategy, prepare for manual replacement by provider. Question 47. Which newborn finding requires immediate intervention? A. Acrocyanosis. B. Nasal flaring. C. Rooting reflex. D. Positive Babinski. Answer, B. Nasal flaring. Rationale, sign of respiratory distress. Strategy, assess respirations and oxygen saturation. Question 48. What is the priority for a newborn with meconium-stained fluid and poor respiratory effort? A. Stimulate by rubbing the back. B. Suction the airway. C. Dry and wrap in blanket. D. Delay cord clamping. Answer, B. Suction the airway. Rationale, prevents meconium aspiration. Strategy, airway first, then stimulation. Question 49. A postpartum woman has temperature 38.3 degrees Celsius on day 2. What should the nurse do? A. Document as normal. B. Encourage fluids and ambulation. C. Notify the physician. D. Obtain urine specimen. Answer, B. Encourage fluids and ambulation. Rationale, slight temperature elevation may result from dehydration. Strategy, temperatures greater than 38 degrees Celsius after 24 hours may indicate infection. Question 50. Which newborn reflex should disappear by 4 months of age? A. Moro, startle, reflex. B. Rooting reflex. C. Babinski reflex. D. Grasp reflex. Answer, A. Moro, startle, reflex. Rationale, persistence beyond 4 months indicates neurological abnormality. Strategy, no normal reflex timelines for Nclex. You've just completed 50 of the most critical Nclex obstetrics questions. Remember, it's not just about memorizing facts, but understanding why each answer matters. If you found this helpful, drop your score or feedback in the comments, and don't forget to watch till the next part where we tackle high-risk maternal and fetal emergencies. Stay focused, stay consistent, and you'll conquer the Nclex with confidence.